The TMJ-TMD conundrum is real and has been puzzling the dental and medical professions for decades. This is the TMJ-TMD Demystified podcast with Dr. Tony Urbanek, where we'll connect the dots between TMD symptoms and the actual cause. We'll tackle common TMD misconceptions and educate you, the practitioner, about a simple, tested, and proven TMD solution that has already provided relief to thousands of patients, while helping practitioners build an additional source of income free from insurance control. Welcome to this episode of the TMJ-TMD Demystified podcast.
Hello, all you TMD warriors. Good morning, good afternoon, and good evening to you, whatever time you are watching this, and welcome to TMD Demystified. If you already don't know, I am Tony Urbanek, and we are here to discuss everything associated with TMD. Today, I did quite a bit of research on this topic, which I have found extremely interesting, and I hope you will too. If nothing else, from just looking at TMD from a major different point of view. This is really important and critical. I have spent several episodes, either in full or in part, discussing my opinion as to why the dentist needs to become the physician of the oral cavity. And that ties in extremely well with today's topic. I think maybe some of you will be surprised, but I hope that anyone watching this, it will really get you thinking about why you do things in dentistry. So the title that I selected is going to be TMD and Systemic Disease. TMD and Systemic Disease. Now, I'm going to go through this carefully at first and probably repeat myself a few times. Excuse me for repeating myself, but it's that critical. Times over equals certainty. So how and why is TMD associated with systemic disease? And on first blush, if you've been educated in dentistry over the past 50 years, there hasn't been much of anything said about that, with the exception of relatively new information that has been documented and published regarding periodontal disease and its relationship to certain systemic problems like heart disease and stroke and diabetes. And that's what we're going to kind of explain today a little bit. I'm not going to talk about periodontal disease. We're going to talk about temporomandibular joint disease, TMD. So let me take you through the logic and the facts. TMD is actually inflammation within the temporomandibular joint. And we talked at length how inflammation within the temporomandibular joint directly causes all the symptoms that patients and doctors are well aware of. So we won't go through that again. You can look up on several other episodes where I specifically describe the relationship and how that comes about, where inflammation within these joints, which are like any other joint in the body, the knee, the hip, the elbow, the shoulder, when they become inflamed, they cause symptoms. And the most common symptom is pain, localized pain for sure, but inflammation in this joint and other joints cause related symptoms. And the symptoms of TMD, well accepted, well respected, well researched, are frequent or recurring headaches, ear aches, jaw pain, neck pain, ringing in the ears, fullness in the ears, vertigo, dizziness, shoulder pain, upper back pain, arm, hand, finger tingling, and numbness and locking. But it all originates from inflammation within the joint. So if you have inflammation in the joint, very similar to the issues with periodontal disease, there are chemical structures that create then the domino effect, which spill down and create effects throughout the body. So this is really no different. TMD is no different in originating inflammation at a specific point in the body as periodontal disease. It's chronic inflammation. Now there's a cascade of events. Chronic inflammation is let's start out this way. Chronic inflammation begins because of an insult to the body. And we've identified the three types of insults to the temporomandibular joint that create inflammation or damage within the joint. First, you have to have damage, then you have inflammation. But the original insults in this joint are mechanical. They're not biochemical. They're not temperature related. They're not burns. They are not bacterial. They're not viral. They're mechanically induced. And the three mechanical induced categories, the damage of temporomandibular joint, are, in order of frequency, bruxism, clenching or grinding, and acute trauma, which can be most often motor vehicle accidents nowadays, but can be anything. Falls and hitting the jaw, the face, 4x4s off the back of the pickup truck, as I frequently tell my male patients, and frequently bar fights or boxers or football players can create quite a bit of trauma to the temporomandibular joint. And then the third category is functional malocclusion, which I've covered extensively in several other episodes. So the mechanical insults to the temporomandibular joint are three in number: bruxism, acute trauma, and functional malocclusion. And all three of them are mechanical insults, but they create the inflammation, and the inflammation creates the symptoms locally. And we consider these not just in the ear or the joint itself a local symptom, but all of these are localized symptoms associated with inflammation. But we're talking about systemic disease now. And just like periodontal disease has been shown to have a relationship and a causal relationship with other kinds of systemic problems because of the chronic inflammation. That is the common denominator between periodontal disease and temporomandibular joint disease, whatever the inciting factor is chronic inflammation. Now, chronic inflammation is a topic that has been thoroughly studied, but not thoroughly mastered. In my preparation for today, I took the time to get a review article, and I refer this to anyone who really wants to get deep into this, but it's not necessary. But this is a review article from 2006 by a bioengineer from California, University of California, San Diego, by the name female, I believe, by the name of Gert W. Schmidt-Schonbeam. And it was published in the Annual Review of Bioengineering in 2006. But a very, very thorough review of what is currently, or at least as of 2006, currently known about the cascade effects of inflammation, and why, once the inflammation is developed, how it gets developed, and then what happens after the inflammation is developed as far as healing goes. Because inflammation is nothing more than the body's attempt to take a damage, whether it be mechanical or thermal or via bacteria or viruses, to take that damage and to remove the damage one way or another and repair it. That's what inflammation is in layman's terms. This article is a really good example. It has 336 references that were referenced during this article. And I refer it to anybody. It's not necessarily an easy read, but it's not complicated either. It's very well written for someone with a dental background, easily understood. And in this article, she goes through the mechanisms of that cascade of events, which are multiple biochemical reactions that, number one, identifies the damage and brings the necessary cells and fluids into the area, remove the damaged portions, and repair the damage, usually with scar tissue. In fact, always with scar tissue, some kind or another. So the point of this message is pretty simple. If you haven't gotten it already, that the same concept that relates to periodontal disease and systemic problems relates to TMD and systemic problems. So if you have chronic inflammation in the temporomandibular joint that goes on for 5 years, 10 years, 20 years, 30 years, 40 years, it's like having chronic inflammation on the dentition for 40 years. And the effect on that in creating additional problems or future problems or current problems with the vessels of the heart or the vessels of the brain, or the vessels of the pancreas, or the vessels of the liver. You can see, and that's where the damage is done when this cascade events of cells and fluids goes on, which is not just local. Of course, it becomes localized, but that cascade of material is throughout the body through the vascular system, and that is why it is known that chronic inflammation increases vascular permeability and allows cells to transfer through the vessels. And that is why those tissues can be affected at very long distances from the temporomandibular joint or the periodontium of the teeth. And I'm not going to go through what's in this article. That's why I brought it to your attention. If you really want to study the different cascades of materials, this is just a wonderful article that describes that. But the common denominator and the general category of the beginning of the cascade of events are called cytokines, and that's the only cellular type or fluid that I'm going to just mention. But when you have damage, for whatever the cause, in this case mechanical, because temporomandibular joint damage is always mechanical, it stimulates cytokines, which there are various types, but they're all in the category of cytokines, and they actually stimulate that cascade of events that brings the necessary changes within the area, within the vascular system, bringing in the proper types of cells to do away with the damage, remove the damage, and to rebuild the area as best as possible. Of course, it rebuilds with scars. All right, so I think I've gone over that more than enough, but I want you to visualize then I thought about making a diagram, but your visualization on this is just as good as mine. So if you can visualize the average temporomandibular joint patient, and the average patient that I see in this office, average, has 20 years of symptoms, 20 years of symptoms, most of them beginning in adolescence. Most of the females I see on questioning will tell me that their symptoms began in their teens, sometimes early teens, sometimes as early as 12 or 13, most of them middle teens, some of them late teens. We've talked about why why it's a female problem. Estrogen exacerbates inflammation. That is why TMD is 95% a female problem. Estrogen exacerbates inflammation. That is covered well on a previous episode. And then once they begin having inflammation, then they begin having the first most common symptom is headache, which is what they complain of most often in the teen years. And then it expands into neck pain, into jaw pain, into shoulder pain, et cetera, et cetera. You have to have these symptoms going on usually for many years before you get into ringing, fullness, and dizziness. But everybody's different. But the point being that these patients have chronic inflammation for decades, very often before they're even recognized for what it is, TMD. But seriously, I have a handful of patients that have had symptoms for 50 years. I mean, they're in their 70s or late 60s. I remember one lady in her 80s, and we traced it back. I mean, all these symptoms were going on for 50 years, and she had seen multiple doctors for one or more of these symptoms over that period of time. And, you know, none of them had recognized it as TMD. When you get rid of the inflammation, though, the symptoms go down. But the most important part is that you lessen the probability that the patient will develop other systemic problems like vascular problems of the heart, vascular problems of the brain, vascular problems of the pancreas, which can lead to diabetes, Alzheimer's disease, stroke, and heart disease. Because that cascade of events, beginning with the cytokines, will traverse the entire body and land on other vascular areas. Most, and this is in the paper, the smallest vascular areas, small vessels, where it has most of its effect. And of course, your cardiac vessels and your brain vessels certainly can be categorized as small vessels. So inflammation can, which is caused by trauma to the temporomandibular joint, then cause TMD, temporomandibular joint disorder, which, if unrecognized, allows the patient to have ongoing chronic inflammation for 10 years, 20 years, 30 years, 40 years, or even 50 years. Would you allow your patient that you see on a routine basis that has periodontal disease to let it go on for that long? Of course you would not. Of course you'd advise them. And nowadays, because of the work done on relationship between periodontal disease and systemic disease, you more than likely would warn them. It's like, really, we need to get your periodontal disease under control, whether it be having to remove the teeth or do periodontal surgery or deep scaling or whatever, but we need to get rid of this chronic inflammation. And you would be remiss not to do that, doctor. And if you didn't, you would be held accountable to your colleagues in the state board, which that brings up a whole other topic as to how the dental profession is monitored, but that is for a different podcast. That doesn't even apply to this podcast. But, you know, if you didn't tell the patient they had periodontal disease and really needed to get treated, you would not be doing your duty. And the same thing applies to temporomandibular joint disease, but it's overlooked so often because it's misdiagnosed, mistreated, not only by you, the dentist, but by the medical colleagues, medical profession in general. And the patient comes in and says, you know, I'm having headaches all the time. First thing that the physician does is order an MRI looking for brain tumors, where if they just knew enough to do this maneuver, and if the joint's hurt, you have your diagnosis, the joint's inflamed. If you push on a knee or an elbow with your fingers or your thumb in motion, while in motion, and it hurts, the doctor knows the joint is inflamed. The same thing applies to this joint. If you push on that joint while it's in motion from the open and closed position, and it hurts, the joint's inflamed. If it's not inflamed, it won't hurt. You'll feel pressure, but you won't feel pain. So you made the diagnosis, inflammation of the temporomandibular joint. And that inflammation of the temporomandibular joint, allowed to go on long enough, can literally be related to, and so many studies need to be done. I am not an expert in this area. I don't claim to be an expert in this area, but I've developed my thought process and experience and my training in dentistry, in medicine, in cell biology and anatomy to understand the relationships really well. And I'm bringing this to your attention because you need to apply it to your practice and your patients and your colleagues. We need to get rid of this chronic problem that is pandemic, especially among females, because 45% of females have temporomandibular joint symptoms, meaning there's inflammation within the temporomandibular joint. So we have got 45% of the female population in the United States of America who have chronic inflammation going on in their body, stimulating cytokines, which stimulates the domino effect of all of the inflammatory cascade, which on top of creating localized symptoms can create future problems of the brain, the heart, the liver, the kidneys, and the pancreas and others. Autoimmune disease. I mean, there is so much that is unknown about inflammation. I want you to understand that we could study it forever. What we know is what we know, and the more that the research community studies inflammation, the more they find out they don't know. But we know autoimmune disease is inflammation that is stimulated. Autoimmune, the immune system is associated with inflammation, and autoimmune disease is the immune system, the inflammatory response cascade is stimulated against its own tissue. And autoimmune diseases, there's multiple diseases of that type, are poorly understood scientifically. Fibromyalgia is another example of an autoimmune disease that is poorly understood, but limited to females primarily. You almost never see a male with fibromyalgia. It's almost exclusively females. Why? Because estrogen exacerbates inflammation. When you know these simple facts and connect the dots, it all becomes very obvious. It really does. So, doctor, I hope that what I brought to your attention today gets you at least thinking in a different direction as to how and why you need to be interested in treating TMD, and how important it is, because it's a pandemic problem with 45% of the females in the United States, and your part or potential part to be the physician of the oral maxillofacial structures, which I believe, and I'm the proponent, not alone, that there's a wide disparity between how dentists think of themselves and what they practice versus physicians. There's nothing wrong with being a mechanic, a tooth mechanic. I don't say that word, I don't say it to incite criticism at all. I, as an oral and maxillofacial surgeon for my entire career, take great pride in that I was a facial bone mechanic. And patients would ask me, or I'd be out socially and say, "What do you do?" I said, "Well, I'm an orthopedic surgeon of the face," or I would say, I'm a face mechanic," because my entire earliest part of my career, for sure, the first 20 years of my career, spent almost all the time in the operating room, taking apart the facial skeleton one way or another and putting it back together, going through and using soft tissues, however was necessary, cleft lip, cleft palate, trauma to the face. But I was a mechanic. A surgeon is a mechanic. But as I can promise you, when you're in there doing facial skeletal surgery, the last thing that you're thinking about is the cascade of inflammation, the cascade of inflammatory cells and fluids, as to how that's going to heal what you're doing. That's the last thing you're thinking. You're thinking about millimeters and positioning and the different aspects when a surgeon. So it doesn't, you're not limiting the ability of a surgeon, but he is not thinking about, at that time, being the physician of the oral and maxillofacial region. He's a technical guy. He's building a scaffold. He's literally, so there's a big difference between technical and thought-provoking. So I would encourage anyone listening to this to think it through and think of why and how you need to consider the treatment of temporomandibular joint disorder as a primary purpose and tool that you use in your practice for the betterment of your patient, not just for local regions and local symptoms, but also for their systemic health. And I would encourage you to read up on it. There's a lot to read. There's a lot to know. You're not going to know it all. But if you read it reasonably thoroughly, then you can get into an honest, practical, fact-based discussion with your patients as why they don't need to be ignoring these symptoms. They need to have it treated. And of course, what we found is the best way to treat inflammation in the temporomandibular joint is to unload the joint. I use this description with patients very often, that this device, which we had to call the Urbanek device because we didn't want to call it the miracle device. I had a patient yesterday call it a miracle, and we have it all the time, but just yesterday. And I don't know how to respond to the patient. I honestly don't know how to respond. I thank them. She was so appreciative. She almost broke into tears. I could tell she was really getting emotional because she was a young lady in her early 20s and she had suffered so much from the symptoms. But the point is, I'm trying to stay on the point, that this device does nothing more than unload the temporomandibular joint, and you can use it long enough because you can speak with it in your mouth. You can wear it 24/7 for a while. We devised the protocol best to use it, which is 24/7 for 2 months and then nighttime only. In most cases, in almost all cases, there are variations, but the point is, if you unload a joint, knee, elbow, hip, and it's inflamed, the inflammation will go down. Now, you may not be able to stay on crutches for your knee your entire life, but you can stay on this device indefinitely, nighttime only, which unloads the joint adequately, even though you're clenching or grinding, because it isn't going to stop. It didn't stop any trauma that happened to you, and it doesn't stop the chronic trauma of bruxism, but it unloads the joint adequately to allow the inflammation to die down so that the symptoms go away. And when you do this, it doesn't hurt by unloading the joint. And that's what this device does, which we were forced to call the Urbanek device rather than miracle device, which the patients wanted to call it. So anyone out there who would like to join us and become a network provider in using this device and protocol, we can be contacted. I remind you, it is patented, and I would hope that those involved will adhere to the patent. But I can be reached at Tony at tmjservices.net. Our director of marketing education, Naomi, can be reached at Naomi at tmjservices.net. Our website is, as you would expect, www.tmjservices.net. And I would look forward to any comments or even criticisms. I always remind you, I'm happy to listen to your criticisms, either directly to us, or you can post them on this platform at Dental Town. We have gotten, I think, tremendous results from the episodes that we posted here on this podcast. I believe this is going to be I think this will be episode number 66. It's going to be entitled TMD and Systemic Disease. But we have some of our episodes that have been reviewed over 100 times now, and many of them in the 50s, which is actually surprising to me, because at the beginning, TMD, among the general the 660,000 dentists throughout the United States, has not been on their high priority to even investigate or be interested in. But we're getting increasing numbers of people who visit this podcast on the Dental Town platform, and they're opening up episodes that I made 12, 14 months ago. So I encourage you to contact us if you'd like to learn exactly how to do this and apply it to your patients, to become licensed and to have access to the device itself. And if you'd like to post a criticism, I'm happy to. Please prove me wrong. If people in the scientific community, people in the dental education community want to take their time to prove me wrong on anything that I say, I welcome it, because I am there to solve the problem, and I want to do it the best way that I know how. So for today, I think I've gone on long enough for sure. I always appreciate your attention. I appreciate those who follow this along, and especially I appreciate our network providers who I know follow us along on this platform and watch our episodes. I am Tony Urbanek, and this is TMD Demystified.